It's a distinct pleasure for me. The steering committee wanted to introduce something that was a little bit different than the traditional panels and lectures. And so the idea of talking about history of thyroid and some of the luminaries in thyroid medicine and surgery. And then we heard about Dr. Peter Kopp, who is somewhat of a mini historian and is going to give a very eloquent lecture on the topic of Theodor Kocher. If you actually Google Theodor, the first person who comes up is Theodore Roosevelt and the second one is Kocher. Dr. Kopp is an absolutely fabulous clinician and internal medicine endocrinologist specialist. He works at the Feinberg School of Medicine at Northwestern in Chicago. He's a professor of medicine, endocrinology, and molecular medicine. He directed the Center for Genetic Medicine there. More importantly, he is the editor of Thyroid. If you look at Thyroid, the most recent impact factor was 5.5, which is absolutely fabulous, and he has raised the impact factor over the last several years to a very high level, and it's a most impressive journal. Dr. Kopp is well known for so many wonderful publications. He's really a luminary in thyroid disease and endocrinology. It's our distinct pleasure to welcome a keynote speaker, Dr. Peter Kopp.
Well, thank you very much for this introduction, which is maybe too generous. Ladies and gentlemen, dear colleagues, good morning. I'm deeply honored by the invitation of the program committee to deliver this keynote lecture highlighting Theodor Kocher. I know that many of you call him Kocher, but I assure you that his name is indeed Kocher. Of note, Kocher passed 100 years and 2 days ago. Thus, it is a very opportune moment to highlight his legacy, this legacy of this inspiring personality. Kocher obtained his medical training at the University of Bern in Switzerland, my own alma mater, where he then spent most of his career and rose to international fame that culminated in him being awarded the Nobel Prize in 1909. Who was this man? What was his impact on thyroidology and surgery? Why was he awarded the Nobel Prize in Physiology and Medicine? What were his guiding principles? Theodor Kocher was born in 1841 in Bern as the second child of Jakob Alexander Kocher and Maria Wermuth. His father was an engineer, active in public transportation with a keen scientific interest. His mother was a profoundly religious woman raised in a Herrenhuter family, a branch of the Moravian Church, the oldest Protestant denomination. Kocher was heavily imprinted by the mathematical and scientific interest of his father, as well as by the religious devotion of his mother. He insisted on entering school a year early, and he was a brilliant high school student. This picture shows Kocher at the time of his baccalaureate in 1860. After completion of his high school studies, Kocher completed medical school at the University of Bern from 1860 to 1865, and he was promoted Doctor of Medicine in 1866. During medical school, he spent a short time at the University of Zurich, where he met the famous surgeon Theodor Billroth, who greatly impressed him. After completing his medical studies, Kocher visited leading surgeons and physicians in Europe to deepen his education. Among others, he visited and observed von Langenbeck in Berlin, Jonathan Hutchinson, Thomas Spencer Wells, and Joseph Lister in London, and then Louis Pasteur in Paris. During his studies in England, he became aware of the new antiseptic surgical techniques to which he then strictly adhered. Kocher was fluent in German, French, and English, which allowed him to gain broad access to the important literature and to communicate with the thought leaders worldwide. So here you see the trajectory of his studies. And in 1867, after his return to Bern, he obtained his Venia Docendi, the license for academic teaching. And he became the assistant of the German of surgery at the old Inselspital, the hospital of the University of Bern. Importantly, he introduced the new techniques of antiseptic wound treatment, which was still in its infancy. In 1869, he quit the academic position for financial reasons and entered private practice. He continued, however, to be actively engaged in academic teaching and research and published his first important scientific contributions. In 1872, the former chair of surgery, Albert Lücke, left Bern, and although the faculty proposed another candidate, the Board of Regents overruled its recommendation after petitions and protests from the local physicians and the student body, as well as strong letters from von Langenbeck and Billroth, and appointed Kocher as chairman of the University Clinic of Surgery at the age of 31. Kocher held this position for the next 45 years until his death in 1917, declining numerous offers from major European universities. So to understand the contributions to surgery and pathophysiology of the thyroid, it is important to emphasize that the physiological function of the thyroid gland was not known in the late 19th century. Switzerland was a country with severe iodine deficiency, and the population was heavily affected by endemic goiter and cretinism. This slide shows a map of the goiter prevalence in male military recruits. The darker the regions, the higher the goiter prevalence. Of note, a goiter was a reason for exclusion from military service, which is compulsory in Switzerland. At the bottom left is one of the numerous examples, in this case from a house in Bern, how goitrous individuals have been depicted in the arts. The right panel shows my first mentor in endocrinology, Max Pierre Koenig, who had obtained his training in endocrinology at the Mayo Clinic, with 3 cretins from the Bern area. In the 19th century, goiters were treated with iodine injections, and first attempts were made to excise the thyroid surgically. The surgical resection of goiters was feared and associated with a very high mortality rate. Samuel Gross, the Nestor of American surgery, has stated that whoever contemplated operating a thyroid should be regarded as a butcher, and that all patients exposed to thyroidectomies were likely to perish. Fortunately, this is not the case nowadays. The development of general anesthesia. Here, the first public demonstration of the use of diethyl ether as a general anesthetic at the Massachusetts General Hospital in 1846 here in Boston by William Wharton in the Ether Dome had a significant impact on the development of surgery in the following decades. In 1872 to 73, Kocher performed 13 thyroidectomies, emphasizing strict antisepsis, ligature of vessels, and placement of the incision in skin folds. To this day, the necklace incision is designated as a Kocher incision. In 1869, the famous Billroth reported his experience with 60 thyroid operations. The mortality rate was 20%, which was comparable to the mortality of other endocrine surgical theories of that time. Kocher changed the surgical approach and insisted on rigorous vascular control, avoiding injuries to the recurrent nerves as well as the parathyroid glands, whose function was not known either. In addition, Kocher was the first endocrine surgeon who systematically analyzed his outcomes and surgical complications, including bleeding, recurrent laryngeal nerve palsy, and mortality. Now, around the same time in England, William Gull briefly described a cretonate state supervening in adult life in women in 1874. This clinical entity was subsequently confirmed by Ord in 1878, and he called it myxedema, a cretonate affection occasionally observed in middle-aged women. Ord also observed that the condition is associated with an atrophy of the thyroid gland. While none of the authors was aware of the causal role of the thyroid in the pathophysiology of the myxedematous condition, they emphasized the phenotypic appearance and its resemblance with cretinism. In 1882, Jacques and Auguste Treverdin, two surgeons from Geneva, Switzerland, presented a series of 21 thyroidectomies and described the consequences on the patients. They described the clinical picture as myxœdème opératoire and accurately described the phenotypic changes resulting from total thyroidectomy. About half a year later, in April of 1883, Kocher reported results on 200 thyroidectomies performed by several surgeons in Switzerland and Germany. 101 performed by himself at the Congress of the German Society for Surgery in Berlin. These findings were then summarized in his most famous publication, Über Kropfextirpation und ihre Folgen, which stands for goiter extirpation and its consequences. In this series, Kocher meticulously described the sequels of total thyroidectomy, and he coined the name cachexia strumipriva. It is important to note that 19 of the case reports in this series have been provided by the Reverdin, thus Kocher was fully aware of their data. At that time, Kocher performed a radical resection of the whole thyroid gland, to which he referred as radicale chirurgie. His mortality rate was 12.8%, which was considered low. These famous pictures, which are part of Kocher's case series, illustrate the consequences of total thyroidectomy. Maria Bixel, the taller girl standing in the back, is shown before the thyroidectomy at the age of 11, and 9 years later, where she is the smaller woman standing to the left, together with her younger sister who did not undergo thyroid surgery. This second illustration shows a 50-year-old man before and after total thyroidectomy. In the discussion, Kocher speculates quite broadly what could be causing these alterations. He notes, however, affirmatively or definitively, to pick up on the previous talk, that these observations demonstrate a clear connection between the thyroid gland and cretinism. Unfortunately, the Reverdin and Kocher then had a long-standing feud over claims of priority about the description of the metabolic consequences of total thyroidectomy. While it is clear that the first public report was the one of the Reverdin, it remains somewhat unclear whether the three surgeons came independently to the same conclusion. Later in the same year, on November 23, 1883, Dr. Daughtry Druitt presented a patient with classical symptoms of hypothyroidism in the Clinical Society of London. Felix Semen, a Prussian who had moved to Great Britain and who had assisted Kocher's presentation in Berlin, then commented that there appear to be three conditions closely allied to each other and having in common either absence or probably complete degeneration of the thyroid body, namely cretinism, myxedema, and the state after total removal of the thyroid body. Thus, there was a growing awareness of a relation between the thyroid and the myxedema phenotype. Perhaps Felix Semen merits more credit for connecting the dots. To further investigate the observation by Gall and Ord, as well as the findings of the Swiss surgeons, the Clinical Society of London established a committee which came to the conclusion that myxedema, total thyroidectomy, and cretinism all result from the annihilation of the function of the thyroid body. 3 years later, in 1891, George Murray reported that the injected sheep thyroid extract is able to cure myxedema. And shortly thereafter, Kocher reported in 1893 that the ingestion of raw thyroid tissue attenuated or cured the signs and symptoms in patients suffering from cachexia strumipriva, findings that were confirmed by others. Based on these observations, Kocher abandoned his initial views that the thyroid was regulating the blood flow to the brain and recognized that it has an effect on metabolic regulation. He stopped performing total thyroidectomies and replaced them by partial thyroidectomies, leaving the posterior part of the gland in place. He called this physiological surgery as opposed to radical surgery. However, Kocher quickly realized that the so-called subtotal thyroidectomy resulted in goiter recurrences. This could only be avoided with the introduction of salt iodination after 1920. Of note, total thyroidectomy through capsular dissection was only reintroduced in the 1980s. In the subsequent years, Kocher further improved his surgical technique, which resulted in a significant decrease in the mortality rate. A series of 600 patients reported in 1898 included only one death, and the mortality then remained below 1% in his hands. Impressively, Kocher was involved in 7,052 goiter resections, and 5,314 of them were performed by him personally. This indeed identifies him as a high-volume thyroid surgeon. Kocher's numerous contributions to thyroid surgery and physiology and his investigations into the causes of endemic goiter and cretinism then culminated in his receiving the Nobel Prize in Physiology and Medicine in 1909, the first surgeon to receive this honor. His Nobel lecture entitled Pathological Manifestations in Low-Grade Thyroid Disease is an impressive account of the efforts of himself and his contemporaries to improve surgical outcomes and obtain insights into the pathophysiology of the thyroid. This illustration included in his lecture shows this young woman who underwent a total thyroidectomy and subsequently developed severe hypothyroidism. She was then treated with thyroid extract, which resulted in obvious improvement. 5 months after discontinuation of the therapy, she developed again profound hypothyroidism, but improved under therapy with iodine, a thyroid extract. In the discussion, Kocher emphasizes the importance and difficulty of finding the right dose of thyroid substitution in order to avoid hypo or hyperthyroidism. Amazingly, more than 100 years later, I still struggle with this clinical problem every day. The fascinating history of the introduction of iodine prophylaxis initiated systematically by several Swiss physicians shown here and Marine in the United States in the early 20th century has to be discussed at another moment because of time constraints. Like Marine, who spent several weeks in Bern in 1913 with Kocher, Kocher felt that goiter development was not caused by iodine deficiency, but that the administration of iodine counteracted an unknown goitrogen. In 1917, shortly before his death, Kocher presented a talk at the Swiss Society for Surgery where he still held this view. He mentioned the efficacy of prophylactic iodine administration to school children. Here, a young girl from Switzerland studied in these series, but failed to discuss the beginning goiter prophylaxis through iodination of table salt in Switzerland. Of note, around the same time, in 1914, Kendall isolated thyroxine. Kendall, shown here, working at the Mayo Clinic, succeeded in crystallizing thyroxine on Christmas Day 2014. Initially, the compound was called thyroxine. Later, when it was found to contain an amino acid, the name was changed to thyroxine. In 1950, Kendall was awarded the Nobel Prize for Physiology or Medicine, along with Swiss chemist Tadeusz Reichstein and Mayo Clinic physician Philip Hench, for their isolation of the hormones of the adrenal cortex. Slowed by the First World War, it took more than a decade until Harrington successfully synthesized thyroxine in the laboratory in 1926-1927. Of note, synthetic thyroid hormone became clinically available only in the 70s. Until then, desiccated thyroid hormone preparations were the only form of treating hypothyroidism. I think it is important to be aware of these historical perspectives when we enter discussions about therapy of hypothyroidism with various thyroid hormone preparations. So what was Kocher's impact on surgery? Under Kocher's tenure, the surgical clinic in Bern became an internationally known center that attracted numerous leading surgeons of his time. He was well known in Europe and overseas through his widely translated scientific work and his intensive travels, both resulting in lasting impact on surgeons and surgery worldwide. This included, among many others, William Halsted, Harvey Cushing, and Charles Mayo. The state of surgery and surgical tuition was less than optimal in the late 19th century in the United States, and better trained surgeons, realizing the limitations of their environment, regularly sought to visit Europe. Kocher was already well known to American surgeons because his textbook on operative surgery had been translated and published in America in 1894. Halsted, shown in this picture while observing Kocher, visited Bern in 1899, and this encounter resulted in a long-lasting personal and professional interaction. Professionally, both were committed and dedicated individuals, possessed of an almost obsessional pursuit of detail, whether anatomic, pathological, or surgical. Kocher had a major impact on the surgeon of his time because he developed a new style of surgery, focusing on meticulous dissection of tissues, careful hemostasis, and strict adherence to antiseptic techniques. Moreover, he carefully documented the clinical presentations, procedures, and outcomes. Kocher also introduced statistical evaluation in order to analyze mortality rates, complications, and outcomes. He also performed epidemiological studies, for example, on the incidence of goiter in the canton of Bern. To a public interested in endocrine disorders, it is of particular interest to know that Kocher had a significant impact on Harvey Cushing, who glowingly acknowledged the mentorship and friendship of Kocher. Cushing obtained his surgical training under the guidance of William Halsted at Johns Hopkins in Baltimore from 1896 to 1900. Apparently, the relationship between Halsted and Cushing was uncomfortable, and Cushing sought exposure to other mentors. Halsted supported Cushing's request for spending time with Kocher, who had published on his experiences with spinal cord surgery. Cushing then spent 14 months in Europe between 1900 and 1901, 5 of them with Kocher in Bern. Kocher proposed a research project addressing the factors responsible for regulating intracranial pressure to Cushing, who took on this challenge very successfully. In addition, he worked on muscle physiology under the guidance of Hugo Kronecker, a leading physiologist. Based on Cushing's diary, it seems likely that his experiences in Bern, and in particular his interactions with Kocher, were essential for his intent to pursue a career in neurosurgery. In this context, it is of interest to briefly sketch the history of transphenyl surgery for pituitary lesions. The transphenyl approach was developed in the early 1900s. Early attempts to choose this route were hampered by limited exposure, poor illumination, and disfiguring scars. In 1909, Kocher proposed an approach using submucosal dissection of the nasal septum for the resection of a pituitary adenoma in a patient with acromegaly. This was an important improvement because the submucosal resection reduced the risk of infection, and it led to a much better cosmetic result. Oskar Hirsch, a rhinologist from Vienna, further developed the endonasal approach. Cushing was aware of the work of these surgeons, and he performed the first sublabial incision with submucosal resection of the septum in 1910. But he then abandoned the transphenyl approach after 1929 in favor of the transcranial route. One of his mentees, Norman Dutt from Edinburgh, continued to use and modify the transphenyl approach after his fellowship with Cushing, and Gérard Guillot, a French neurosurgeon, learned the transphenyl technique from Dutt and facilitated by improved illumination and intraoperative imaging, popularized it in the late 50s. Kocher published more than 140 publications, among them the internationally acclaimed textbook of surgery, Chirurgische Operationslehre, which was printed in 5 editions and translated into many languages. Kocher's most important area of research, including 23 publications, focused on the surgery and pathophysiology of the thyroid gland. In addition to his work on the thyroid, Kocher made significant contributions to many fields of surgery. This included, among others, a new method to reduce dislocations of the shoulder, innovative approaches to hernia repair, gastrointestinal surgery, Kocher, for example, the Kocher maneuver to mobilize the duodenum, including the head of the pancreas, orthopedics, urology, shock, spinal cord and brain lesions, gun wounds, osteomyelitis, hemostasis, and asepsis. The arterial clamp, developed by Kocher in 1882, bears his name to this day, and he developed many other surgical instruments. I had the privilege to view a collection of his personal instruments that were recently legated by the family of a Bernese surgeon, Dr. Alexander Kneta, to the Burgerbibliothek of Bern, the public academic archive of the citizens of Bern. Kocher's instruments were produced locally and widely sought after by the surgical community. I'm very fortunate to have some of these instruments in my personal collection, and if any of you wish to hold an original Kocher instrument in your own hands, please join me after the lecture. So now, given that I don't have a functional pointer here, I now have an adequate instrument. Important for the audience of the World Congress in Thyroid Cancer, Kocher made several comments about struma maligna, cancer of the thyroid. In an extensive discussion of the malignant thyroid lesions, he reported on roughly 400 cases of malignancy in close to 4,500 operated goiters, which would be close to 9%. Obviously, the histological criteria for the diagnosis of cancer were very distinct from our current framework. In this work, Kocher calls attention to the fact that cells in hyperplastic goiters may resemble cells found in thyroid cancer. He reports a high frequency of bone metastases from thyroid cancer, which suggests that these were frequently follicular cancers, which are more prevalent in iodine-deficient regions. Lastly, he complains bitterly that the diagnosis is often made too late, and the tools for early diagnosis are necessary. Maybe we're facing another problem now. Kocher received innumerable professional honors, including honorary memberships of numerous universities and professional societies. He was the president of the German Society of Surgeons in 1902 and the president of the First International Surgical Congress in Brussels in 1905. He was also a founding member and the first president of the Swiss Society for Surgery. Kocher was extremely popular as a teacher and attracted numerous top students from Switzerland and abroad, and he trained numerous leading surgeons. To the thyroidologist and endocrinologist, three of them are of particular interest. First, Fritz de Kervin, who followed Kocher as chairman of surgery at the University of Bern after Kocher's death, is of relevance to thyroidologists because he recognized the entity of subacute or granulomatous thyroiditis, which carries his name as eponym, a name that may be even harder to pronounce than Kocher for some of you. The second mentee who is worth mentioning is César Roux from Lausanne, who described the Roux-en-Y procedure and who, in 1926, performed the first successful surgical removal of a pheochromocytoma. After visiting Roux's clinic in 1900, Harvey Cushing wrote, I quote, "He is a rough diamond, an interesting man, looks like Kipling, does excellent work, and comes nearer to being the kind of man I'm looking for than anyone else I have seen." Also interesting from a historical perspective is the fact that the first to recommend preoperative biopsy for tissue diagnosis of thyroid tumors and better planning of surgery was Karl Kaufmann, another of Kocher's mentees, who recommended this approach in his 1879 publication on malignant goiter. In 1880, Kocher received a call as professor to Prague, then the third largest university clinic in the German-speaking world. Many colleagues, especially international ones, urged Kocher to accept, while Bernese doctors and colleagues begged him to stay. Kocher used this call to demand improvements for the newly planned university clinic from the Bernese government, and his innovative concepts were instrumental for the construction of the new university hospital, the Inselspital. His demands were accepted. The building of the Inselspital started in 1881. His credit for surgical equipment and books were increased to 1,000 Swiss francs, and the number of surgical beds was also increased. The new Inselspital then became one of the most modern university hospitals in Europe. Nowadays, the Inselspital is a large modern hospital complex with a few remnants of the Kocher time remaining. These buildings, well familiar to me from my time as a medical student and resident, are beautiful islands in the constantly changing landscape of a modern hospital center. Let us focus again on Kocher as a person and his legacy. In 1869, Kocher married Marie Vichy-Courant. They had 3 sons. Kocher's letters to his wife are a testament of a very caring and loving relationship. His eldest son, Albert, became a prominent surgeon himself and was an assistant professor of surgery at the University of Bern. Albert also had a close friendship with Harvey Cushing. The Kochers had a very open house that became a place for friends, colleagues, guests, and even patients. 3 years after winning the Nobel Prize, Kocher donated 200,000 Swiss francs to his university and established an endowment that allowed the building and financing of a basic science research institute at the University of Bern. Of note, the funds donated by Kocher consisted of 90% of the Nobel Prize money, which was about 227,000 Swiss francs. This sum corresponds to roughly $38,000 in 1909 and would have a value of about $1 million today. To this day, the members of the Kocher Institute consist of highly competitive basic researchers who perform high-impact research in immunology and angiogenesis. Kocher worked until his death in 1917, and he died a few hours after completing his last surgery. His private house was donated to university and is now the house of the university, impressive place for official functions. His colleagues and mentees described Kocher as a humble and modest man, rather reserved with a dry and tactful humor. He had a forceful, charismatic, yet self-critical personality and was a tireless worker, who also served as dean of the medical school and rector of the university. Kocher was highly focused on his professional life and his family, leaving almost no time to leisure, and he only traveled for professional reasons. Like his mother, Kocher was deeply religious. His ethical views, which are well documented in thoughtful letters to his wife and children, were profoundly imprinted by his Christian beliefs. He strongly expressed his conviction that active service to mankind is an obligation, but that it must be guided by conscientiousness and humility. He expressed in his writings, but also in public talks, that the rise of materialism was a great evil. He was profoundly affected by the outbreak of the First World War, struggling to understand how the major European countries, which he greatly admired, were drawn into this chaos. To him, the explanation was to be found in materialistic greed, an absence of moral principles, and religious values. During the war, he traveled repeatedly to Germany and France to visit military hospitals and study war injuries. In one of his essays, he asked, I quote, "Which state of the mind makes it possible that courageous and capable people choose to make in their task or profession to murder their fellow men, or to mutilate them, to shoot them to cripples, to let them starve?" Unfortunately, these questions and concerns have not lost their weight and actuality a century later. Ladies and gentlemen, a century after his passing in 1917, Kocher's legacy is lasting. His many contributions to medicine and surgery, his exemplary professional service, his dedications to his patients and mentees, his scientific rigor, and his humble humanism remain an inspiration to this day. To quote Harvey Cushing, "So for those of you, his spiritual grandchildren, who have gathered here and to whom Kocher is little more than the name, I would like to give at least an impression of what he was in life. A slight, sparse man of personal neatness, of quick step and alert bearing, of unfailing courtesy and dignity, precise and scrupulous in all his dealings, professional, public, and personal, a man to trust. I thank you very much for your attention.
Thank you. Well, obviously that was well received. What a fabulous lecture. On behalf of the steering committee, thank you so much for being a keynote lecturer at World Congress 2017.
Thank you.